Trigeminal nerve, a very important nerve of our face. The motor signals that come off the base of the brain go to control the movements of our jaw, and our chewing motions are controlled through the motor part of the trigeminal nerve. Now we have three sensory areas of this trigeminal nerve. The first is the ophthalmic area, and that's going to cover the scalp, the forehead, the upper parts of the sinuses, the upper eyelid, the actual cornea of the eye, and the bridge of the nose. Then we have a maxillary area, which is going to cover in through this area. So the lower eyelid, the middle part of the sinuses, the nasal cavity, the cheeks, the upper lip, and the roof of the mouth. And then we have the mandibular division, which is going to cover the teeth of the lower jaw, the lower lip, and all the chin areas. So any part of those nerves can get irritated. We call it, for short, in doctor terms, we call this V1, V2, and V3. So any of those areas can get irritated. One of the common irritations is a TMJ problem. A problem in this temporal mandibular joint can feed a lot of scrambled information back through that trigeminal nerve and create headaches. And we'll see that quite often. And so the ways that we reset that is we will, for example, we could tap on the jaw, and we could use our red light therapy and our adjusting at the same time to reset those motor connections into the jaw. Then, because the sensory divisions carry pain, light touch, deep touch, pressure, vibration, hot, cold, that sort of thing, we can stimulate those nerves with light touch or deep touch or pressure or vibration, and use our red light therapy and use our adjustments at the same time to reset that sensory communication from the nerve itself back to the brain. And then, of course, if the TMJ is out of alignment, we want to either adjust the TMJ directly, and we use an instrument, no twisting or popping, or we use a cranial release technique, which resets the coverings around the brain and spinal cord and restores the proper communication into this jaw. So those are some of the ways that we help with those issues, and it can make a huge difference in a person having headaches or having facial pain or other things of that nature. Now, sometimes the upper neck is involved with that because the upper neck is so close to the TMJ. We get some overlap there, but it's very important that we test the TMJ and we test the trigeminal nerve. So we'll take a strong muscle, we will stimulate the trigeminal nerve. It could be light touch or pressure, and then we will see if the nervous system reacts. And if it does, then we know there's a problem there. We might tap on the jaw, see if the nervous system reacts through change in a strong muscle, and if so, then there's a problem with the motor areas of that. And then we're going to use that information to find out how we can reset this trigeminal nerve and help a person with headaches or facial pain or other issues. So I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.